Hey, this is Rick Cassells from exercisesforinjuries.com. Now I wanted to give you some insight and advice on what to do when you go to the bathroom on an airplane. Now I know you know what to do when you go to the bathroom on the airplane, but maybe let me kind of give you some other advice that you can end up doing while in the bathroom of the airplane. And it's for any individual whose back ends up getting sore on the plane. Sitting for a long period of time ends up irritating their back. I know if you've been reading EFI or exercisesforinjuries.com, you've known that I've been flying all over the place for about 2 months. And it's been a coast to coast and country trip. It was San Diego and then back home in Vancouver. And then it was New Brunswick. And then it ended up being Tampa. So it's been lots of long flights across countries and across continents. So what I try to end up doing is, with myself, is my back ends up getting irritated when I sit too long. And in a previous video, I kind of talked about, kind of the number one exercise that you should end up doing in order for your back to feel better. But in this video, what I'll end up going through is, what to do on a plane. So when it comes to a plane ride, if the plane ride is greater than an hour, so definitely if it's 2 to 6 hours in length, usually every 2 hours, what I'll try to do is get up out of my chair. When it comes to flying, I like to end up having the window seat. And the reason, the window seat on the right side of the plane, and the reason why I like that is I'm a right-handed person, and if I end up utilizing my laptop, I end up using my right hand in order to do the mouse work or the most of the typing. And if I have a seat a window seat on the right side of the plane, you end up having a little bit of more room to do some computer work when you're on the plane. But even though I'm on a window seat, I still make sure I get up. Yes, sometimes I end up inconveniencing the person beside me or the aisle person. I try to do my best to find a good time that's convenient for them, but every 2 hours I still try to get up. And so I'll get up because a sitting position is more stressful on the back than a standing position. So in a standing position, you have your lower body acting as a shock absorber, your muscles in your lower body acting as a shock absorber for your low back. But when you're sitting, those shock absorbers are gone and you're right on your tailbone, and there ends up being more stress on the back, especially if the person in front of you reclines and you don't have a ton of room to do computer work. You a lot of times don't get put in the best position on the plane. So when I get out, every 2 hours I try to get out, what I'll end up doing as I'm going to the bathroom ends up being a leg drag. So I'll put my hand up against where all the luggage is to get balance. I'll take a step forward, I'll contract my glute and kind of drag my leg. And then I'll go to the next one, contract my glute, drag my leg, and just kind of alternate back and forth, contracting that glute, dragging that leg as I go to the bathroom. And what that ends up doing is activating my glutes because they haven't been firing or working properly from sitting so much. It fires up my hamstrings to do the same. That firing ends up stretching the front of my hip, which oftentimes will end up getting tightened up from sitting so much. And that contraction and stretching ends up helping put my pelvis into a good position. So that ends up being one of the exercises that I end up doing, and then I put my hand on the luggage just so I end up having good balance if there ends up being any type of turbulence happening. So that ends up being exercise 1. Exercise 2, I'll go into the bathroom, and what I'll end up doing is, what I've done with that leg drag, I've kind of done an extension focused exercise, trying to open up my body and move it into extension. I'll go into the bathroom and I'll do a hip flexion exercise. So I'm up against the bathroom wall, my seat, my mid-back, my head, and then what I'll end up doing is bringing my knee up, grabbing my knee, and pulling it a little bit further and coming back down. So I'm good alignment, grabbing it, pulling it a little bit further and coming back down. Things that I really want to remember is my back. I'm not flattening my back out. I'm not crunching out my back. It's got my seat. I can put a hand width underneath my back, so there's a gap. I got my mid-back, I got my head. I'm pulling up and back. And then what I'm doing there is mainly a hip flexion movement, stretching out the hamstrings, stretching out the glutes. That ends up being the second exercise that I end up doing. And then the third one I end up doing ends up being a back extension with a glute contraction. So what I'll end up doing is a little bit wider of a stance than what I talked about before. I'm gonna grab the hips, I'm gonna arch back, but with this time I'm gonna contract the glutes. I'm gonna arching back, contracting the glutes, and coming back up. And so what I'm looking at there is engaging the glutes, stretching out the front of the hip, working on getting that alignment back in my back, and working on improving and returning that normal alignment in my back. And I'll just end up doing 5 repetitions. So with the first exercise, the leg drag, I'm doing that all the way to the bathroom. The second exercise, I'm just going on like 5 on each side, making sure I don't flatten out my back. And then the back arch with glute tightening, I'm just going through 5 again. And once again, I'm going through progressive in nature. So 2, 3, 4, and 5. And then if there's anything else that I end up having to do in the bathroom, I would do it at that time. But after going through that little routine and doing those 3 exercises, my back ends up feeling a lot better. And those 3 little exercises, I've done them flying wherever. So give those a go and see how your back ends up feeling. Now remember, there's about 5% of people that are extension intolerant, so they don't like extension or arching back movements. So they wouldn't end up doing that the back arching with the glute tightening exercise. Now, I mean, if you haven't been to exercisesforinjuries.com, swing by exercisesforinjuries.com, enter in your pain or injury. There's a good chance that I have an article, a video, or a resource that will help you. Secondly, if you're watching this on YouTube, head up above, hit subscribe. What that'll do is you'll end up getting videos like this every couple days where I end up kind of chatting about injury and pain, or end up having a special video from one of my friends or a special guest. Thirdly, head down below, hit like, let me know what you think of this video, or leave me your injury or pain questions. So there you go. This is Rick Caselge giving you some advice on what to do in the bathroom while on a plane. So this is Rick Caselge saying take care and bye-bye.